Hello, I'm Leona Gilbert with Tested. Tested is a medical device manufacturing company situated in Jyväskylä, Finland, and we have developed a complete SARS-CoV-2 serological test, and I'd like to spend some time to talk to you about it. Our mission is to get the patients and the people tested properly and thoroughly so that the patient can be appropriately treated, recover quicker, and get back to normalcy, get back to work, get back to loved ones. So we want to do our part, and that's with the development of SARSPLEX, a SARS-CoV-2 antibody test that is CE and IVD marked and ready to be shipped. Due to the fact that this coronavirus created a global crisis and is pandemic, we are concentrating and focusing our resources in actually producing SARSPLEX for the people. So SARSPLEX is an ELISA-based platform that tests for the immune response of IgM, IgG, and IgA against two specific proteins from the novel SARS coronavirus that we are seeing in this crisis. SARSPLEX is manufactured under ISO 13485-2016 standards, and as I mentioned, is CE and IVD marked. SARSPLEX incorporates innovative multiplex concepts in that we are testing for two different proteins coming from the virus, the spike 1 protein and the nuclear capsid. By adding to both of these proteins in the test kit, it has increased the sensitivity, specificity, and the overall robustness of this diagnostic kit. And also, it is multiplex in actually analyzing the immune response against three different antibodies, the IgM, the IgG, and IgA. And it's important to actually holistically screen these three antibodies because we can demonstrate seroconversions and immunity in individuals. And this is important to see if the individual can fight this virus, fight this viral infection. In the next slide, you can see the test performance. If you look holistically and analyze both IgM, IgG, as well as IgA together, you can see that we are actually reaching 100% sensitivity and 100% specificity based on a clinical validation study of 149 individuals. SARSPLEX also has been independently validated in both in Germany and in Spain. In the next slide, you can see actually a picture of SARSPLEX. It is a kit that has 10 ELISA plates in it. Each plate actually tests for 28 patients or individuals against the three different antibodies. And as a whole, you can see that this test kit can test up to 280 individuals. The interpretation of the results of SARSPLEX is textbook, meaning in that if IgM is present, it means acute infection and possible primary infection. If IgG is present, it indicates current or recent infection, or a past infection or an ongoing infection. But if IgA is present, it shows mucosal immunity. There's antibodies raised and present in mucosal areas, such as the lungs. And it's important that we screen for all three antibodies so we can see the mucosal effect and the systemic effect of immunity in an individual. It's also interesting to screen all three antibodies because we can get an investigation of the ongoing outbreak, both in the community and globally. We can also analyze retrospectively the attack rate or the extent of the outbreak. And as WHO has indicated and repeatedly it's stated, we need to test these individuals. So the benefits of SARSPLEX is actually quite interesting because it's vital to actually screen the immune response for the control and resolution of this viral infection. Both mucosal and systemic immune responses are there to aid in fighting the viral infection. And as the virus infects the lungs first, it's important that IgA is within the testing scheme to indicate immune fitness to combat the virus. We at Tested are looking for collaborators and partners. We're looking specifically for clinical laboratories to perform the test and or distributors to help us get the patients tested. To run SARSPLEX, you need standard equipment that every lab has if they are doing already ELISA-based platforms. It is a standard 450 nanometer reader, a spectrometer, and as I mentioned, most hospital laboratories and clinical laboratories will have this machine. So if you are interested in helping us get the patients tested, please contact me at leona.gilbert@tested.com. Thank you.